My group decided to do our presentation on the human immunodeficiency virus, better known as HIV. The people in my group are me, Brinley Hess, Cade Moore, and Megan Curtis. First off, what is HIV? HIV stands for human immunodeficiency virus, and this virus can eventually lead to AIDS. AIDS stands for autoimmune deficiency disorder. HIV and AIDS is also known as sexually transmitted infections. HIV is a chronic disease with a no known cure for it. It damages our immune system, making it hard to fight off simple infections and diseases such as the common colds or the flu. It can be spread through needles, birth, and sexual contact. HIV will destroy your T cells, and T cells are used to fight diseases. T cells are white blood cells that maintain our immune system, and without these, one can easily die from the common colds or common illnesses. Historical background of HIV. So HIV first started affecting people in the 1970s, but scientists had not yet were unaware of its existence. Now there are more than 35 million cases, and in 1980, people were dying young from common diseases because they were getting HIV and were not able to fight off those diseases and infections. By 1981, scientists had put the dots together and discovered HIV and AIDS. Around 1901, gay men and dirty needles users were at high risk, and scientists figured out that HIV was either sexually transmitted or bloodborne through dirty needles. There was a lot of confusion about this disease. It was really thought as a gay disease or gay cancer. Then there were some documents of mothers passing it on to their babies through breastfeeding. Originally, it was thought to be only related to gays. But in 1995, they discovered that it affects mainly people through 25 and 44, and it doesn't have to be transmitted through gays. It can be transmitted through anyone, including women. There were also 2.5 million cases of AIDS. The entertainment industry and sports community suffered the most from this disease. But in 2005, they were successfully administering medicine, and obviously the world was learning about safe sex and safe drug use, so that helped too. This is the HIV life cycle. So the life cycle attacks and destroys the CD4 cells of the human immune system, and the CD4 cells are a particular type of white blood cells. These cells play a role in protecting our body and fighting off us from getting infections. HIV uses machinery as the CD4 cells to multiply and spread throughout the whole entire body, and this process is carried out within 7 steps or stages and is known as the HIV life cycle. Portal of entry for HIV. HIV gains entry through attaching itself to numerous membranes, including tissues and linings, and in the human body, these linings can be found on the tip of the penis, the vagina, the rectum, and or the mouth. This usually occurs during sexual activity. Most people thought that HIV was transmitted through only the tip of the penis and the vagina, but lots of people are unaware that it also spreads through the rectum and the mouth.
We're talking about the route of transmission of HIV. So the only way that this virus can be transmitted is through blood, through semen, rectal fluids, vaginal fluids, and breast milk. So the organs that this virus affects is, first let's go by systems. There's the immune system, the respiratory and cardiovascular system, digestive system, your central nervous system, your integumentary skin, which is your skin. So with the immune system, and this is actually where you start seeing some of your symptoms, is through flu-like symptoms, can cause fever, chills, diarrhea, sweats, joint pain, muscle pain, etc. Then with the respiratory and cardiovascular, it can make it harder to breathe, which is common with cold or flu-like symptoms, and like pneumonia, I guess more like pneumonia-like symptoms. So it definitely affects your respiratory, and then there are risks of developing high blood pressure, which affects the cardiovascular. With the digestive, you can sometimes you can I mean, it's different for everybody, but you can get a decrease in appetite, and makes it really hard for you to eat, which is also a side effect. With the CNS, it doesn't affect like the nerve cells, but it does infect like the cells that support and surround the nerves of the brain and like throughout the body. And then with the integumentary, since you already have a weak immune system, which is generally what the main issue of HIV is, it leaves you more vulnerable to like herpes and other viruses of your mouth and genitals. Okay, so this quote says, as of 2022, it is estimated that the adult HIV prevalence rate is 6.2%, a 1.2% increase from data reported in the 2011 UNAIDS World AIDS Day report. In Western Europe and North America, most people with HIV have access to treatment and live long and healthy lives. So for the most part, if you just are quick with testing and treatment and taking your medications properly, you should be able to live a pretty healthy life with this virus. Okay, so at the end of 2019, an estimated 1,189,700 people aged 13 and older had HIV in the United States. Although the study is in the United States, HIV is almost everywhere. This is a virus that can be spread pretty easily without people being aware that they have it, or not telling other people that they have it, and not taking their medications properly, and just not doing exactly what they're supposed to with this virus. It can be spread.
So mortality rates have been cut in half since 2010. There's a lot less people that have it because we know how to deal with AIDS better and HIV. And people can live better with HIV now due to medication. Patients will usually get flu-like symptoms, and whatever infection or whatever sickness you have could be amplified because of a lack of immune system. So there's no known cure for HIV or AIDS yet, but hopefully there will be one in the future, and there are drugs to help you live with HIV. Antimicrobials are medications that are used to prevent and treat infection in humans, animals, and plants. However, they're becoming resistant to antimicrobial medications, and the world is evolving. There are other treatment methods: getting healthy and eating healthy foods, vaccinations, medicines, and getting enough protein, amino acids, probiotics, vitamins, and minerals, and also body practice and mind can help. There are some preventative measures for HIV. So if you have HIV, you should definitely tell your sexual partners if you have it, because that would be not fun to get a new sickness from that. male circumcision, obviously using a clean needle, using a condom while having sex, and using protection as much as possible, and also taking medication. These are our references. Thank you for watching.